you and your partner have decided that this is the year that you are going to have a baby, then I advise you to watch this video before trying another month. Because as a gynecologist, I see many couples who are trying to get pregnant make these small mistakes that only delays their pregnancy and adds additional stress. These mistakes and advices are all science-based, evidence-based, no social media myths. Hi, I'm Dr. Geeta, IVF specialist and gynecologist. On OR Medica, I talk about women health, infertility, gynecology and obstetrics. I'm going to share 6 mistakes to avoid for natural pregnancy. So let's get started. Mistake number 1. Expecting the pregnancy to happen within 1 or 2 months. I know once you have decided that you want to get pregnant and you want it to happen right away, but that is not true and it won't happen, because for healthy couple in their 20s or early 30s, for each cycle the chances of getting pregnant is only 20 to 25%. So give yourself proper period of 6 months before feeling to worry. For 6 months, you just follow natural pregnancy methods. What happens if you expect results within 1 or 2 months is that you get stressed every time you get your period. Stress is very harmful because studies have shown that people, especially women with more stress hormone, conceive very late than compared to women with less stress. So always give your body the time that deserves, that is 6 months, or sometimes I expect them to try for a year after some certain tests. Second mistakes that I come across in my clinic and my online consultation is calculating the ovulation wrong. Everybody thinks everybody ovulates at day 14, but it's not the case. Everybody's cycles are different, everybody's ovulation is also different. Even within a woman, her ovulation will be different from 1 month to another month. So how to calculate your cycle length is day 1 of your proper bleeding to next month's day 1 of proper bleeding. Scanty bleeding, spotting, that you do not consider it as day 1. Always consider proper full bleeding as day 1. So calculate how many days you took day 1 of full bleeding to another day 1 of full bleeding. So this is your cycle length. Like this, you calculate for 2 to 3 months and find the average. For example, I got the cycle length as 28, 30, 32. So in this average would be 30. So her cycle length is 30. And you subtract 14 from this 30, that is 16. That is the day you ovulate, or around that date you ovulate usually. So keep 2 to 3 days before and 2 to 3 days after of this ovulation day and have regular sex during this period. Mistake number 3. Believing myths about intercourse. Some say this position is good for pregnancy, some say this diet is good for pregnancy, some say drink this, you will get pregnant faster. These all are just hooks to attract your attention. There is no evidence for any of the diet or any of the drinks or any of the sexual positions that the pregnancy is better than the normal positions. Mistake number 4. Avoiding overall health of the couple. Many couple who are trying to get pregnant only worry about ovulation, timing and intercourse. But fertility is not only about that. It is the overall health of the couple. Not only women partner, not only male partner. It is the couple that have to make fertilization. Overall health meaning maintain your BMI within the normal range. I will give you the link to calculate your BMI. Second thing is not doing any physical exercises. Just 45 minutes of walking or 20 minutes of weightlifting is essential to get pregnant. Third one is diet. Watch your diet. Just giving some attention to what you eat will bring a lot of changes in your body. Everybody knows sugar is bad, processed food is bad, oil is bad, but many tend to ignore it on day-to-day basis. Mistake number 5. Trying naturally when you should be seeing a doctor. Many patients think that they are normal and they try naturally. If you have these things, please consult a doctor. Do not try naturally because you will waste your precious years while trying naturally. So, what are these conditions? These conditions are irregular cycles, if you have scanty or less periods, if you have severe pain during periods, and your husband doesn't perform sexually, that is, erectile dysfunction or retrograde ejaculation, or the semen is very less. In these conditions, do not try naturally. Always consult a doctor, get hormonal profile done, basic pelvic scan and tube test is must for women partner, whereas a simple semen analysis is must for male partner. Mistake number 6 and final mistake, which is very important, using lubricants and douching the vagina. These lubricants kill the sperm which is trying to get you pregnant. Do not use any lubricants. Even the doctor prescribed KY jelly is no better. Vaginal douching. People clean their vagina thinking that it will clean their vagina and better chances of pregnancy. No. Vagina maintains certain pH which will help sperm survive and swim as well as avoid infection in the vagina. So always do not use lubricants. Prefer natural lubrication. So these are the 6 mistakes you should avoid while trying for pregnancy. Seek doctor's help if you do not get pregnant for 6 months. If you need my help, you can always book an online consultation with me on oamedica.com website. If this video has helped you, please subscribe to my channel and share this video with a friend or with your sister, with somebody who is trying to get pregnant naturally. And if you have any doubts, please comment. I read them. Take care.